Assalamu alaikum wa rahmatullahi wa barakatuh. We are back, alhamdulillah, and ready to resume with our next session. Our next session focuses on an issue that perhaps affects thousands of women every year, and even their families for that matter. Yet, unfortunately, it is not given due attention or care. Having signs of anxiety and irritability just after a baby is born is quite natural for a new mother. But when should the warning bells ring? When should you be concerned that perhaps your anxiety levels are not quite normal? How should you treat it? Those are some very important questions. And to help us figure out the answers, we have Sister Haleh Banani with us today. Sister Haleh Banani has a master's degree in clinical psychology with 20 years of experience. A pioneer in combining psychology and Islam. She has her practice in Dallas, Texas, with a global reach through online sessions. Sister Haleh is the founder of 5 Pillars of Marriage, a comprehensive online marriage program which has helped hundreds of couples. She hosted her own TV show with Haleh in Egypt, where she received her ijaza in the recitation of the Quran. She has been married, mashallah, for 20 years and has 3 children, ages 17, 14, and 11. Sister Haleh, it's truly an honor to have you back with us. We won't keep our participants waiting any longer now, so it's over to you now, sister.
Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for the introduction, and it's a pleasure to be back with IOU, mashallah. Bismillah ar-Rahman ar-Rahim. Inna alhamdulillah, nahmaduhu wa nasta'inuhu wa nastaghfiruh wa na'udhu billahi min shururi anfusina wa min sayyiati a'malina. من يهد الله فلا مضل له ومن يضلل فلا هادي له وأشهد أن لا إله إلا الله وأشهد أن محمدا عبده ورسوله أما بعد. I'm so impressed with mashallah IOU's their effort in getting the mental health issues discussed and brought to focus. I think that our ummah really needs this effort and this understanding and the information, because so many people are suffering silently. I see so many people online that tell me about the depression, the anxiety, all of these issues that they're having, and they never feel like they are validated. They don't know where to turn. So the effort that this is being made, mashallah, with Solace for the past 2 years, I think is really, truly an incredible effort. And may Allah reward all the organizers, everyone who has put effort into it. Inshallah, we'll start with the postnatal depression. All right. We are, inshallah. So first of all, we have to distinguish between baby blues versus postpartum depression. With baby blues, a lot of times after giving birth, what happens is that it's very natural for a mom to feel irritable, to feel a little bit anxious and emotional. However, this usually lasts for like 2 to 3 weeks after giving birth. Now, with postpartum depression, what happens is that you have many of the same symptoms of the baby blues, but it lasts much longer. And sometimes it could be from a few months to a year. When you come home with this, bundle of joy, you have your new baby, suddenly your life is transformed. You are a completely different person. It affects every aspect of your life, right? So whether that's how your body is looking, your relationship with your spouse financially, your work. So basically, when you have a baby, your world turns upside down. Now that can be a very positive thing. Many people embrace the changes and they become excited about it, and it could be a very positive change. But for many people, this change is very overwhelming, which leads to a lot of like the baby blues. Now, the baby blues, what we need to distinguish is that it doesn't last as long, and it's very subtle feelings of, okay, I'm not feeling as excited, I'm not feeling enthused about what I'm doing. But with the postpartum depression, this is serious. This is like clinical depression, where a person cannot just snap out of it. They're feeling extremely overwhelmed, they're stressed, there's this hopelessness, and we're going to talk about some of the symptoms, inshallah. But what I do is when someone comes in and they're feeling depressed, I assess many things. I ask them many questions about their symptoms, about how they're feeling, how long they've been feeling it. And what I have noticed is that most people underestimate their symptoms. It's not about the exaggeration of the symptom. They underestimate it. Many people don't recognize it as being anything valuable, especially with postpartum, because there's so little information out there, especially in our ummah. We are not as informed with the psychological issues. We may not be, there's still a stigma attached to saying that you have postpartum depression or any kind of depression. I was just discussing this yesterday. There was a conference, and I was talking about mental health and how important it is for us not to feel stigmatized, not to feel shame about any of these mental health issues. Now, especially if you have postpartum depression, you have to come out. You need to talk to someone that can show you, give you some, give you the support and guidance that you need. Now, here are some of the symptoms of postpartum depression. I want you to listen to this and see if you have any of these symptoms and if they have lasted for quite some time. Now, some people just start crying, and the reason people cry, it varies. Sometimes it could be like, I'm not cut out for this. A lot of people struggle with a feeling of low self-esteem. And when someone is feeling that they are not good enough, they are not maybe smart enough, they don't know how to take care of a baby, all of these feelings come about, like a lot of feelings of doubt. So the crying could be a sense of like maybe a loss of independence, maybe this feeling of, I don't know, I may not be a good mom. So a lot of self-doubt. There's irritability. The irritability comes because there's a feeling of being overwhelmed. What's happening is that the mother is not getting enough rest, is not probably eating properly, is overworked, underappreciated, and all of this can just lead to a lot of feeling of stress. Now, any one of us, if let's say you're working on a big project or you have a big conference coming up and 2, 3, 4 nights in a row, you're not sleeping well, let's say you average 2-3 hours a night and you don't get to eat, you see how you become. You become very irritable. And this is the state of being for a mom with a newborn for months on end. So it's not just like for that conference or that big project. It is ongoing stress of not sleeping, not eating, not getting that this emotional support. So that's why they become very irritable. Then there is, like I was saying, the disrupted sleep. And this is one of the questions I ask individuals to assess whether they're depressed or not. I ask about their sleep. And one of two things happen when someone is depressed. Either they are sleeping excessively. I remember working at the VA hospital, and I was working with a group of veterans who actually were suffering from clinical depression. And some of them would say, I sleep 12 to 16 hours a day. Well, obviously, that is a sign of depression with excessive sleeping. Then there are individuals who sleep sporadically. They only sleep a few hours a night, and that's an indication of depression as well. So either sleeping too much or too little. Then I ask about their eating pattern, if there's been any change in their eating habit. And again, you find that it could be one of two extremes. Sometimes when people become depressed, they lose their appetite. So you find that they're losing excessive amount of weight, they have no appetite, no interest in eating. And then there are individuals who eat excessively. They are putting on a lot of weight because that's their only, it's like what they call comfort food, right? They start eating in order to gain some kind of satisfaction. And so you have to see if there's any change in the way you're eating or sleeping. This is an indication that it could be postpartum depression, especially if it's lasting a very long time. There's this persistent feeling of sadness, hopelessness, helplessness. Whenever someone is suffering from depression, it is that feeling of lack of hope, feeling that nothing's going to get better, everything is dark, everything is gloomy. And, these are real symptoms. And unfortunately, many people are not sympathetic to a person who is depressed. We are very sympathetic if someone is diagnosed with cancer, if they have leukemia, if they have heart problems, they had a stroke. We are full of sympathy. Our ummah will just run to the side of the person who is suffering from these kind of physical ailments. But when it comes to getting the mental health disorders acknowledged and to feel sympathy for this, we have a long way to go. So I really want you to look at these symptoms and not think of it as, oh, this is not a big deal. So what? They feel a little hopeless. Just snap out of it. We can't expect the person suffering from this to snap out of it, because these are symptoms that they feel, it's like it shackles them, right? And we have to be just as sympathetic and just as understanding. There's severe anxiety. There's problems doing tasks at home. When someone is suffering from depression, I had a client who came in and she was clinically depressed, and the husband always complained about, the housework is not done, she doesn't do the cooking, she's always sleeping, she doesn't get out of bed. And the brother was a physician, and what I told him is that you deal with these kind of, let's say, individuals who are physically sick and they have certain symptoms. You can't get upset from them for having a certain symptom. And these are just the symptoms of depression, not being able to pull it together, slacking off. And it's not really slacking off, but not even having the energy or the motivation to do the housework. And there's lots of interest in activities you used to enjoy. This is one of the biggest signs of any form of depression, whether postpartum or not. And many of these symptoms that I am describing are the same for, let's say, clinical depression. We have just honed in on the postpartum. But if you find that you have many of these same symptoms and you didn't just have a baby, then you may be suffering from clinical depression. Loss of interest in the activities you used to do. Maybe, you used to go out biking or walking, or you used to get together with your friends playing some kind of sport, and you just don't feel like doing anything. People tell you, let's go to the park, let's meet up, let's have a get together, and you really want to shut down, you want to crawl into your bed, and that's all you want to do. So social isolation, feeling withdrawal and unconnected, that happens because what's happening is that a person is wallowing in self-pity, and they're not feeling good about themselves, so they don't really want to interact with anyone. And there's that feeling of worthlessness. They feel, oh my God, I'm such a bad mom, I'm doing this, I should be happy. And so there's a lot of self-criticism and really feeling like unable to take care of yourself or the baby. I had one client who, she was so overwhelmed by all of these symptoms that I'm talking about that she moved in with her mother, because she's like, I know I'm not going to be able to keep it together. And she, alhamdulillah, she knew her symptoms and she got the help and support she needed, which is really important, because many people are not aware and they keep pushing. The spouse is expecting them to get over it and to keep up. The family puts pressure. And then they just get burnt out, and then their symptoms become worse. So it's very important to recognize and take action for it. And then there's the obsessive thought about your baby's health. Some people become really overwhelmed with keeping the baby alive and healthy. I know it sounds absurd, but that is one of the biggest fears of a mom of a newborn, especially if it's your first one. It's like, oh my God, how can I keep it alive? And what if something happens? What if I drop it? What if I do something wrong? There's this constant fear. That's why I would recommend, what to expect, that whole series of books, what to expect when you're expecting, what to expect the first year, what to expect the toddler years. Those are excellent books, and definitely will ease your mind. There is also having negative feelings about the baby. Sometimes, unfortunately, new moms, they just feel like, oh my God, this baby is a source of all my problems. It's a source of my sadness. It's a source of all the difficulties I'm having. And then there's that fear of being alone. So some of the more of the symptoms that I'd like to cover, it's, you know, a lot of times because of society's expectations of a woman, let's say, working, contributing, because of all those societal's expectation, what happens is that when a woman gives birth and is at home and is not maybe contributing, maybe they were accustomed to working or being active and suddenly they're homebound, then this really makes a woman feel overwhelmed. They may be more irritated. There's this feeling of emptiness. There's a feeling of emptiness and numbness, and you feel like you're just simply, you're going through the motions. And this has a lot to do with external validation and internal validation. External validation is when we are looking outside to get that feeling of self-worth, right? And it's very natural for us to have certain needs of external validation, but it shouldn't be our main source of self-esteem. Our source of self-esteem needs to come internally. We need to feel good about what we're doing, how we're feeling, and know that the time that we are spending with our children, raising them, and it's all such a huge source of sadaqah jariyah, that we are being rewarded, that this is something that within Islam, the role of the mother is so praiseworthy. And it's, you know, when the Prophet ﷺ was asked about who do I need to value, he said, your mother, your mother, your mother, 3 times, right? So the mother gets the gold, the silver, the bronze medals, and the husband gets, you know, the father gets honorable mention. The role of the father is actually very important. And I'm not trying to undermine the role of the father. And I'm actually going to talk about how you as a husband, if you're tuning in, how much you can play a very important role in helping your wife to either get out of this depression or to avoid it altogether. Because not everyone goes through this. You can do some preventative work and help in this process, inshallah. So this feeling of being empty, this feeling of, you know, feeling like you have nothing to offer. And, you know, again, there's that lack of not wanting to eat, feeling that there is just a lack of interest in everything that you're doing. And people, you know, it's very common to not be able to focus, to forget. And I remember being pregnant, and not just pregnancy, but after giving birth, it's so hard to remember things. So please, spouses, husbands, be very patient with your wives. If they forget to do the things you've asked them to do, know that this is also part of the symptom. And inshallah, this is a period of time that will pass if you're both patient and you seek the help, and you will be back to yourself soon, inshallah. So some of the causes of postpartum depression, first of all, there are physical changes. So after childbirth, you know, you have the dramatic drop of hormones, the estrogen and progesterone in your body, and this can contribute to postpartum depression. So the changes in the hormone, and then there's other hormones produced by your thyroid gland. They can also drop sharply, and this can leave you feeling tired, sluggish, and depressed, okay? And then there's also the emotional issues. Emotional issues when you're sleep deprived, like we were talking about earlier, and overwhelmed, you may have trouble handling even minor problems. So you may be anxious about your ability to care for the newborn. You feel less attractive. You struggle with your sense of identity, or feel like you've lost control over your life. So any of these issues can contribute to the postpartum depression. Now, there are so many psychological effects when having a new baby, because like we're saying, your body, first of all, changes, your role, your life, your marriage, everything is under scrutiny, and you also feel that all of these changes happening at once. So if it was just one thing, then you may be able to handle it much better. But when it's all at once, that's what can be overwhelming. And I think the most important thing to realize is that this is a period of time. It's like a wave that you need to ride through. Not that you don't get the attention and the medical attention that you need. I highly recommend that. Maybe getting some therapy sessions to help you overcome it, but realize that it is a temporary period of time. Not to be so overwhelmed about it that this is going to be your life forever. And once you recognize that, then you're going to be able to handle it much better. And some of the other causes of postpartum depression is, like I was saying, the change in your body. There's also change in your marriage. What happens is that suddenly you went from only being the two of you, having all the free time, all the independence, and then suddenly there's this new baby who kind of comes between you, and this can really affect the marriage. And the advice that I have for sisters is, I know that your whole focus is your baby, but don't forget your husband in the process, okay? This is one of the biggest mistakes that women make, is that when they have their kids, the husband went from being their pride and joy and the center of their world and the center of their focus, and suddenly all of that shifts. And that's why a lot of husbands actually, they feel left out. They sometimes even admit that they feel a bit resentful, a little bit jealous of the baby. And it's very natural to feel this way. And I think as women, we have to be very conscientious of this and do our best to share our attention, share our time with the baby and with our husbands, because this can be either a unifying force, having the baby. It can really build you as a family, but if you're not careful, then it can really divide you, because the man will always feel like, he lost his position, he is not getting the time and the attention that he requires. So that's going to be really important. Keep the husband involved. Don't criticize what they're doing if they're helping, if they're trying to change the diaper, even if it's not done well. You can very gently and sweetly correct, but you don't want to criticize, because then the husband will just withdraw, not help out, and then the wife will be like complaining about the fact that she doesn't have any help. So I think you have to be very careful about this. So the change in your marriage is something to be very aware of. Keep your husband as the focal point. Give him the love and attention he needs, so that it doesn't break you apart as a family. And many women obsess about their weight, their body image, and everything is based on comparing ourselves with the ideals that are out there. So when you have gained all this weight during pregnancy and you're not looking your best, it's very natural to feel a little bit upset about it. But when someone is in postpartum depression, it can be a very it's overwhelming feeling of inadequacy. And it's really important for the husband. The role that the husband plays is that make sure you're still complimenting your wife, even if she's not looking at her best, even if she's overweight. Make sure you recognize the beautiful things about her. Don't ever criticize your wife or make fun of her when she's in state, because she's already very vulnerable. She's feeling down and depressed. And if you criticize, then this is going to really be a big blow to her self-esteem. And unfortunately, what I've seen is that many men will admit that they watch inappropriate things online, but and when they watch these things, it really makes their wives feel inadequate, because they're watching people who are like surgically enhanced, and that comparison is very likely to happen. And so the best thing you can do as a husband is stay away from these things. Never criticize, don't compare, and give your wife the compliments. Other causes of postpartum, going back to the slide, is unable to work. Maybe a woman has her sense of identity within her career, and when she's not able to work, then this can be extremely, it can be very depressing for her because she got that sense of fulfillment and contribution by working. And then other times it's the complications during pregnancy or delivery. It could be premature baby. If you have a premature baby, sometimes you have a baby that's born with heart problems. If there's any kind of physical ailment that you have to take care of, that definitely makes things much more overwhelming and can cause postpartum depression. And then there is the financial issue, right? So if you already had, maybe you were struggling financially and then you have a baby, that exasperates your situation. And little or no social support. You know, even if you're living away from your family, I know that many couples are far away, maybe they're living in a different country than their parents or a different state, but I think it's really critical to create your own support group. It does, if it's your family, that's a real blessing. If you have your mom and dad or in-laws and they can pitch in, then that's wonderful. If it's a group of friends that you can support each other. I remember when I had my firstborn, we set up basically a play group for the kids, and so we were about maybe 6 moms, and that was so wonderful. I mean, we would get together, the babies would, you know, crawl around together or play together, and as moms, we were able to sit and share some of our grievances, some of the struggles, some of the difficulties, some of the happy moments. And I remember that we did that, I believe, for a year or two, and it just was such a great source of support. Just knowing that you're not alone, knowing that, you know, all that you're going through is completely normal. So if you don't have your family around you, make sure that you create a support group that you can rely on, that maybe you can watch their kids, they can watch your kids, you can go out, have a date night with your spouse, and try to resume some of your normal activities. And another reason that another cause of postpartum depression is caring for a chronically ill baby. So if your baby is ill, and I remember one of my clients had actually 2 babies that were clinically ill and chronically ill, and she had to be in ICU all the time, and she feared that, you know, her children, they're not going to make it. One had like major speech issues, the other one, it was very serious, and so she really struggled with this. And so aside from all those things that I was talking about, the changes in the body, the relationship not working, all of that, then when you put on top of that, you're worried about the survival of your baby, then you can just imagine how much worse it could be. There are 6 stages of postpartum depression. The first one is denial. Okay, denial, and this is a lot of moms will say this must be what new motherhood is like. It's all right. It can't be postpartum depression because I'm not mentally ill. I'm sure it'll wear off soon. I just need more sleep, right? So most people are in denial about all mental health issues, not just postpartum depression. You know, they may be clinically, they may have a clinical or generalized anxiety, but they just feel like, oh, I'm just a worry wart. That's not a big deal. Or they may have the mood swings, and it's bipolar, but they just think this I'm just moody. My mom was moody. Grandma was moody. This is just our nature. This is in our blood, right? So I think it's really important to recognize our symptoms, and when you diagnose yourself or you go and get diagnosed, that's a really important part of getting cured, because if you are in that state of denial and you don't think that you have any problems, then you can't even take measures to fix yourself or to get the help that you need. So denial is a big part of overcoming denial is a big part of treating the symptoms. The second stage is anger. And that's when you get so frustrated, you're like, nobody understands what I'm going through. Why me? This is supposed to be a time of joy. I don't deserve this. I don't want to take any kind of medication. I don't want to go to therapy. And I shouldn't have to call a doctor. That's not fair. So it's just anger. And anytime we feel angry, we regress. We regress to either teenage years, or it's either our teenage years or we turn into the toddler years, right? And this is from doing conferences and workshops internationally. When I talk about anger and I ask people, this is what they will confess. They will say, when I am angry, I regress to like a 5-year-old or a 2-year-old. So we need to recognize, first of all, when it comes to anger, first of all, we need to have an acceptance of qadr. Everything that happens to us is from the will of Allah. And even if you're going through this depression, it is there for a reason, that this is a part of Allah's plan. Instead of saying it's not fair and why me and I can't, I don't want to go through this, if you simply embrace it and think, what is the lesson that I can learn from this? And you focus on that. And many times I do that in my therapy sessions, where someone may have gone through something, through a tragic incident, or they just lost a loved one, or they lost their job, whatever it is. And I ask them, what can you learn from this? What is it that can, how can you change from this incident? And when I start asking them these questions, what ends up happening is that they start generating maybe 10 reasons why this was good for them. And it always amazes me, because I don't need to come up with it. They come up with it, but it's about posing the right questions. If you just ask, why me? Why do I always have to go through this? You're not going to generate a good answer for that. Right? It's kind of like when you're doing a Google search, the critical part is asking the right question, right? If you don't formulate your question correctly, you're not going to get the answer that you need. So formulate the question by asking yourself, what can I learn through this? What is Allah's plan? What do I need to improve within myself through this experience? Now, whatever your experience can be, if you don't have postpartum depression, you have any other kind of mental health issues, you have any other test in your life, maybe you have a difficult mother-in-law, maybe you have marital problems, maybe you have this, you just lost your job and you're struggling financially. Instead of just saying, why me, and this is not fair, and why do bad things always happen to me, just ask, what am I supposed to learn through this? And it's so powerful when you start reflecting on the right questions. Then you generate such amazing, powerful answers that then you're convinced. And I find the change in my clients, once they see the wisdom behind what they're going through, then suddenly they're like, okay, well, this was to humble me. Maybe I had a lot of pride, I had a lot of ego, and going through this experience has really was a humbling experience. Or maybe it just taught me to be more compassionate. I used to be very judgmental of others, but now that I'm actually going through this, let's say, depression, I'm not going to be judgmental when my friends tell me that they're feeling a little bit down, and I'm going to be much more tolerant and accepting. So just try to do that for yourself so you don't stay in this angry stage. The next stage is bargaining, and if I just exercise more and eat better, I'm going to be fine. If I take my vitamins, I'm going to be okay. If I could just get to the point where the baby sleeps through the night, I'll be okay. And if I get closer to God, if I pray more, this will all go away. I just need to work harder. So this is where, you're still not coming to terms with the issue. The next stage is depression. Okay. Depression, and it's I should just leave my family, I'm bringing everyone down, they all would be better off without me. So this feeling of hopelessness, and my poor baby doesn't deserve a mother like this, I'll never get better, so there's no point in going on. So once a person starts feeling depressed, there's that feeling of worthlessness, there's having thoughts of death, where they feel like they would be better off dead, because a lot of the clients I have are practicing Muslims who know that they know that suicide is haram, and they will even say, we know the position Islam has, that it's, you know, it's a huge sin, and it's just not something they would ever consider. However, the thought of death, the fact that they pray for death, wish for death, or visualize their life, that how much better it would be if they died, then these are all suicidal ideation, right? But people just don't label it as such. They won't say, I have suicidal thoughts. And that's why when I ask my clients, I don't say, do you have suicidal thoughts? I think, do you ever think about death? And then I get a variety of answers. Some people say, yes, I think about that. I feel like, you know, everyone will be better off without me. So that's suicidal. Some people will say, and then you have to follow it up with, I mean, how would you do that if there's a plan? And if someone has a plan, then it's pretty serious, and you need to take action. You need to seek professional help, because if a person says they wish they weren't here, and you ask, how would you do it? I would take, you know, sleeping pills. Some people say I would crash my car. Whatever it is, that is a plan to kill themselves, and you need to just take that seriously. Then other times people will say, well, I think about that, oh, I'm going to meet Allah. Do I have enough good deeds? And it's just so much more spiritual, and that's fine, right? I mean, we should think about death in that sense, that our life is limited, and we need to constantly be working on ourselves in order to achieve a higher status with Allah. However, we need to really distinguish between spiritual thoughts of death, that just being God conscious and I want to live my life to its fullest, and compare that with that sense of hopelessness, that, you know, my life is just not worth living, so I'm better off dead. And then finally, a person will get to the acceptance stage, okay? What's happening to me, it's normal, and I can't ignore it anymore. So you basically come to terms with it. It's not my fault. It's okay for me to talk to a doctor. It's okay for me to ask for help. I can take medication or go to therapy or do whatever is necessary for my health and for my family. So postpartum depression and anxiety are temporary and treatable with professional help. So one of the most important aspects of any illness or anything that you're going through in your life is getting to the point where you accept it, right? And a lot of times when people come into therapy, they are struggling with that. They are struggling with the fact that they can't accept it. They can't accept, let's say, that they are getting a divorce. They can't accept that, you know, there was infidelity in their marriage, or they can't accept their child who's acted out or chosen the wrong path. And that's why they're in turmoil. And until you get to the point where you can accept what has happened and know that this is all part of Allah's plan, then you will not be able to move forward. You will not be able to get beyond the point. So accepting your situation, whatever it may be, and again, I emphasize that you may not have postpartum, but whatever challenges you have in your life, come to terms with it, accept it, and then focus on how you can make things better. Then the next thing is the PTSD, which is the post-traumatic stress disorder. And what it is like, I still worry that postpartum depression will return. I'm constantly looking over my shoulder. So even if you've treated it, then there's like this fear, oh my God, what if it comes back? Every time I feel bad, I'm convinced that I've gone back there. I feel like I've lost a lot of confidence in myself, and I don't know if I'll ever get it back. I worry that I will hurt my child in the long term because of how I was when he was a baby. So, you know, it's any disorder that you have, you could have PTSD with it. When you overcome it, like some people will have a panic attack, right? And this panic attack has occurred maybe once or twice. It lasted maybe a minute or two, but then they spend the next 24 hours for the next, like, I don't know how many months worrying about that panic attack. So it's very common to have post-traumatic stress disorder. And the only way to treat it is to really recognize that you have taken the necessary steps to treat the symptoms, to treat the disorder that you're battling with. And once you treat that, then you will also take care of the PTSD. So it's just a matter of acknowledging it and getting the help. Now, the dangers of not getting treated. Dangers of not getting it. Individuals that have severe postpartum depression have the same dangers as a person with clinical depression. They may harm themselves or harm the baby. And this is why it's so critical for us to not take it lightly. You have to recognize between baby blues and postpartum depression. And I remember when I had my first baby, my mom was very in tune to the baby blues, and she was very in tune with the fact that I may get down. And so she educated my husband about it, and she was very, very sensitive to my likes and dislikes and tried to really accommodate me. And I really appreciate it now when I think back that how in tune she was. And I think this is what we need from the husbands, from the parents. Criticizing your spouse for being depressed is not going to help her. It's not going to give her the boost that she needs, right? Poking fun of her is not going to help her. Right? The only way that you can help is by being supportive, being understanding, not to be judgmental, and to get her the help that she needs, because many times it does end up with the mother either hurting themselves or their baby. And we really need to be knowledgeable enough, take the necessary actions to avoid this. Right? And I think a lot of times we just take it lightly. We don't think it's a big deal. And because we belittle it, then a person just feels that they are stuck and there's no way out. The world feels dark, and they feel like that the only way that they can escape is through doing something horrific. Now, preventing postpartum depression. Okay, preventing postpartum depression, your expectation really affects your experience. So if somebody goes in, so you have to adjust your expectation. If someone goes in and they think that, oh, having a baby, it's all fun and easy, and then they face the reality and they become overwhelmed, and they feel like, oh my God, this was nothing like I expected. Now I remember, when I first had a baby, I'm like, no one told me that you become a feeding and changing machine. Yeah, it was impossible to get out of the house. You feed the baby, then you have to change them, and then they fall asleep, and then that cycle continues over and over again, and it can be very overwhelming. And so you have to also adjust your expectations. Some people look at it as, oh my God, it's a prison sentence. I have a baby now, and then they become very pessimistic about it. And so it's really important to adjust your expectations, take childcare classes, take parenting classes, read books about caring for the baby, and don't get caught up in comparing yourself to others. I think there were at least 8 classes that I took. I loved the idea of learning and being independent. I didn't want to just hand the baby over to my mom or just say, well, I don't know what I'm doing, Mom, you take over. I wanted to be in charge. I wanted to know everything. So I think there was even nursing, how to nurse your baby, how to wash your baby, how to change your baby, like all of these classes when you take it. And a few of them I did with my husband, which was really helpful, because then he could step in, he could remind me of the things that we learned. And that way you adjust your expectation and you're able to carry on and be competent, because one of the biggest reasons that people have that postpartum depression is that they feel that they are incompetent. They're not capable. So the more you learn, whether it's by reading or attending classes, the more you're going to feel competent as a mother. And then you need to prepare a support group, friends and family, and make sure that anyone who offers help, say yes, right? Because when you first have a baby, someone say, "Oh, can I cook for you?" Say yes. And I think what we used to do in that group that I told you about, there was also a halaqa that we had with wonderful sisters, mashallah. And when I had the baby, they took turns cooking for me. I think it was for about a week to 10 days, that each day there was another sister who would come with a lovely meal, bring it over, and it made life so much easier. And I think if you can arrange that for one another, it will be a wonderful source of support. And then make sure you make time to nap when your baby's sleeping. Don't get caught up with the cleaning. If you're a perfectionist, you gotta let it go and just make a little time for sleeping. Now, what I was talking about, how a lot of times moms can become pessimistic, it's really important that we nurture optimism. You know, as a believer, we have no choice but to be optimistic. We really need to work on ourselves, and it's very rare to find individuals who are optimistic. I find that you know, a lot of times going to the masajids, going to different places, you find like people are really struggling with a lot of issues, which I understand. And it's not like being optimistic is being problem free, but you can face your troubles, you can face your difficulties with that sense of hope, because you're putting your hope in Allah. Allah is capable of doing all things. And if you feel like you're stuck and you're hopeless, then you're limiting Allah. Who are you to limit Allah? Who are you to say Allah cannot, you know, fix my problems, or there's no way out? So your yaqeen, right? Your certainty in your dua, in knowing that Allah could solve your problems, is what's going to make you optimistic, right? And so I want to share with you now this optimistic creed, which really affected me growing up. It was a very turning point in my life. I was doing leadership training, alhamdulillah, for 6 years. So from high school, I was in different leadership training programs, which really shaped my personality, shaped my goal setting, everything about me. And one of the things that I learned, I'd like to share with you. So for those of you who are struggling with being optimistic, and you're not sure how to be optimistic because maybe everyone around you was pessimistic, I want to share this with you, inshallah. And within it, okay, so there's lines of this optimistic creed, and then I'm going to relate to you how Islam is, subhanallah, it trains us to be optimistic. So I will give my commentaries as well. So here it goes: to think only of the best, to work only for the best, and to expect only the best. Now this, in Islam, we think of it as husn al-dhan. You think good of others. Your hopefulness is really a reflection of your faith, okay? And in Surah Yusuf, ayah 87, Allah says, do not despair of the solace from Allah. No one despairs of the solace from Allah except for people who do not believe. So this is a reminder that in Islam, we have no choice but to be optimistic. So if you have a pessimistic personality, time to change it. Time to adopt a new way of looking at things. To be just as enthusiastic about the success of others as you are about your own. That's a big one. Not many people can embrace this, okay? And it reminds me of the hadith that says, you're not a believer until you want for your brother what you want for yourself. So if you want to be righteous, if you want to really prove how sincere you are, be excited. When that brother is getting married and you still haven't gotten married, be happy and excited for that. When your friend gets the promotion and you don't get the promotion, be happy for them. If you see that your friend gets the things that they want, they get a baby but you don't have a baby, or the other way around, whatever it is, be content and happy for them. and don't wish bad for anyone, and don't have that feeling of jealousy or animosity, because really all of that leads to the postpartum depression or any kind of depression and anxiety. Okay? To forget the mistake of the past and press on to the greater achievements of the future. And this is really about recognizing that the past does not equal the present. Even if you were a pessimistic person all your life, you can change it. Even if you were an angry person, you can change yourself. To wear a cheerful countenance at all times and give every living creature you meet a smile. And the Prophet ﷺ taught us smiling at your brother is sadaqah. So, and you find that, you know, a lot of times people have a hard time smiling. I have some clients, when I tell them to smile, it's like as if it's a muscle they have not used. They look so awkward, like they just form this very mechanical smile, like they're not comfortable smiling. So smiling, actually the psychology of smiling is really amazing, because the muscles, they give a message to the brain that you are happy. So sometimes when my clients are depressed, I have them do this big goofy smile, and I tell them, okay, try this with me actually. Why don't you sit up straight? Okay, sit up straight. I don't see you, but you can follow the directions. Sit up straight. Give a big smile, ear to ear. I want to like see all your teeth. Okay, you're smiling. Now don't move a muscle. Be depressed. Don't move your muscle. Keep smiling. Back straight. You can't, right? Because when you're smiling that big, your brain is getting the message that you are happy. So even if you're not feeling your best, if you give a big smile, then you are going to train yourself to be happy. Some people just want to look depressed all the time. Their body language, they're slouching over, their facial expressions. So really become aware of that. It says to give so much time to the improvement of yourself that you have no time to criticize others. Okay, I'm going to repeat that one because I think in our ummah, we have a big issue in pointing fingers. We are extremely judgmental, and we look at people and we have this list that we have a checkoff list, right? And we start from from their head to toe, and we judge the scarf, whether they have a scarf or no scarf, whether it's a colorful scarf or not colorful scarf, if it's a niqab or no niqab, whether it's a abaya or a dress or no clothes, not like a hijab, a correct hijab, whatever it is. And it goes all the way down to your socks and shoes and whatever you're wearing. And we put X's, and it goes both ways. The conservatives will look at a liberal and they'll X out all these things and say, oh my gosh, you don't make the cut to be my friend. And then the liberals look at a conservative person and it's like, oh my gosh, I can't be with someone this extreme, and you don't make the cut. And who do we search for? We search for a spiritual clone of ourselves. Whoever is exactly like us, then they're good. But everyone else, we dismiss. So I'm going to repeat this for all of us who have a tendency to be judgmental, to give so much time to the improvement of yourself that you have no time to criticize others. So we need to constantly be committed to self-improvement, to be too large for worry, too noble for anger, too strong for fear, and too happy to permit the presence of trouble. Okay, so that was the optimistic creed. Inshallah, that we can all live to be more optimistic, because that is the Islamic way. Now, preventing postpartum depression, first of all, you can eat well. Eating well improves everything, right? When you talk about suffering from stress, when you have heart disease, whatever the problem is, if you start eating well, you find that it affects your body. So not getting enough of certain nutrients, including vitamin B and vitamin D, can really affect a woman's risk of getting postpartum depression. So sticking to a well-balanced diet can actually put you in a better mood. I have recognized with some of my clients who are bipolar that when they start eating food, let's say with wheat, their mood will just go berserk, right? So they will be very steady, emotionally stable. They will decide to cheat and have the wheat, and they become hopeless, and they go down this depressive cycle. And so we really have to become aware of how the food that we eat, it affects us. Then we need to exercise. Exercising, the physical activity not only helps elevate your mood, it can make you feel a whole lot better about everything in your life. So try to exercise, and then prioritize your relationships. Spend time with your spouse, your friends, join mommy groups, take care of those relationships, inshallah. You know, and getting people to exercise, like if anyone comes in and they're depressed, I get them to do some exercise because it's a great mood enhancer. And, you know, be really aware of not withdrawing, because, you know, there is a downward spiral of depression. What happens is that as you're depressed, the more depressed you are, the more you're going to be withdrawn, which is going to cause more depression. So push yourself. I tell my clients, even if you don't feel like going out, even if you don't feel like seeing people, push yourself to go. So treatment for postpartum depression, cognitive behavioral therapy, this is what I specialize in. It's all about changing the way a person thinks, a person, the self-talk, in order to change their behavior. Self-talk is that internal dialogue that you have with yourself, and this totally transforms everything. And I start with this with every client regarding any disorder that they may be facing, right? Because it's the things that we say to ourselves that affects us. Make sure that you get emotional support. You know, husbands, really be there for your wives through this. Moms, if you're listening, you know, there's no good will come from criticizing your daughters about having postpartum depression. Be there, be understanding, let them feel that they can talk to you and that you will be there for them. Now, there's also antidepressants. There's the selective serotonin reuptake inhibitors, the SSRIs, such as Zoloft or Paxil. These are usually the first choice of medications. There's the tricyclic antidepressants, TCA, such as Elavil or Tofranil, and it may be prescribed next if the SSRIs don't work, okay? And some people use acupuncture. I find that individuals who have used acupuncture for various reasons, not just for postpartum depression, sometimes for stress and anxiety, they find that it's very beneficial. Now, there is postpartum psychosis. This is a much rarer and much more serious than postpartum depression. And the symptoms include loss of reality, there's hallucinations, and delusions. So if you're experiencing any kind of suicidal, violent, or aggressive feelings, hearing voices or seeing things, or have other signs of psychosis, make sure that you call your doctor and you go to an emergency room immediately. This is not something to be taken lightly. And in any situation, even if it's not just postpartum, but if you ever start hearing or seeing things, this is pretty serious. It's, you know, when your sense of what is real and not real starts changing, then you could act out and you could do things that are very, very tragic. So make sure that you seek medical attention. And there's some postpartum resources. Postpartum Support International, which is 1-800-944-4PPD. And then there is Mental Health of America, which is 800-273-TALK. Now, I don't know if you are in different countries, you may find resources in your area. I'm sure that every area you're living with, they have some kind of resources. And then there's the National Alliance on Mental Illness, 800-1-800-950-NAMI, M as in Mary. So hopefully that these will be useful resources. I pray that anyone who is suffering from postpartum depression, any form of depression or any form of mental health issues, that they can get the help that they need. You don't need to suffer. And my message is early detection, prevention, and taking action. Be proactive. You know, there's no need to suffer. I have people coming in, and within 4 sessions, I find that someone can go from being suicidal to having new hopes. I actually had one girl, she was just very young, she was suicidal. Within 2 sessions, she changed her whole life around. So it is very, very important to take action, take the necessary action so it doesn't get worse. And, you know, it's been a pleasure and an honor to be with IOU, and I pray that everyone who put this program together really is filled with lots of ajr, and may Allah forgive all of our sins and accept us to the highest level of Jannah. Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jazakallah khair, Sister Haleh. That was truly amazing to learn about. And we are sure many sisters will resonate with the examples you gave from your own life. And inshallah, find your advice very beneficial.
Jazakallah khair. Thank you so much, inshallah.
We will now take a break and be back in 10 minutes, inshallah.